Hello, I'm Dan Siegel, clinical professor of dermatology at SUNY Downstate and the alternate AAD advisor to the American Medical Association RUC process. I'm going to be talking to you about maximizing reimbursement in the era of changing coding. And one of the points that is very important is that since the changes that came into play in January of 21 with regard to E&M codes, you now have to do more to get paid, but in reality, you're actually working a little less hard because the documentation is easier. But not everyone seems to understand this yet. And here's the issue. Prior to 2021, when you did coding, the auditors would simply count bullet points. So if you hit all the bullet points, you can get paid for it. But now, when we look at the table of risk approach, when we look at the medical decision making that's involved, things have changed. And the person reviewing your chart can't tell what you're thinking. Now, when you and I speak about psoriasis, atopic dermatitis, melanoma, we all know what we're talking about. We have shared commonalities. But when the high school graduate who's reading a chart sees a string of Latin syllables, it means nothing to them. So the problem they have at that point is they have to go ahead and think, what were you thinking? Is this a chronic disease? Is this an acute disease? Is it a chronic disease with progression or worsening? You can't just assume that they will know those things. You have to explicitly tell them. But this is real easy because in the era of the electronic medical record, you can simply modify your templates to tell right after your diagnosis what it is. So psoriasis can be chronic stable. It can be chronic and progressive with side effects of treatment. And there are nuances even here because while it's not in the decision-making table, when you open the CPT book and you read about chronic stable, you will learn that a patient who is not at their treatment goal is not stable. So therefore, they're a higher level of acuity, a higher level of complexity, and therefore that visit may be worth more. And you have to learn how to use that. And that's what we have taught about today, how to make use of that table to optimize your documentation so that when you're audited, which will probably happen because we have had a shift to higher level codes, you'll be looked at. But this will show them what you're thinking and save you time and hopefully protect you on the first pass. And today we really have concentrated on two issues. One is what I call the single lesion take a look visit. And that's very common, and it's important to have these visits in your practice. When a patient looks one morning and they see a new spot and they're thinking, oh my gosh, do I have skin cancer? They're very anxious and nervous. And if they call your office and you're in one of those parts of the country where there's a 3-month wait, you've got a very upset patient. But if you can just fit that patient in for a single lesion look-see, you have the benefit of helping them and helping to build your practice, and you can get paid for your time and effort. Another one that we covered is the whole body examination, because the whole body exam used to be easy. You just check off all the bullet points and it was easy. But things have changed. On the good side, you don't have to go head, check, normal, face, check, normal, neck, check, normal, etc. But you can simply have whole body exam as unremarkable except for a funny looking lesion on the left shoulder that is manifesting as an irregular pigmented splotch that is dermoscopically atypical. You don't need a long, complex discussion, but when you get into the options and treatments, you do need to have a little bit more that targets it. So you no longer need a 3 or 4 page document. You can get by with a much shorter document, but you have to explicitly make note of why you're deeming something to be at a particular level. And if you do that, your life will be easy, the auditor's life will be easy, you'll see good cash flow, and you'll have many happy patients. So enjoy the meeting, and it was great talking to you all today, and have a wonderful time.